here's an important hot tip for when you guys are making your videos. Make sure that when you open your gloves, you are not overlapping your paper with this paper. If you do that, you are now contaminating your sterile field. Okay? So make sure that these are separate and not touching. So as you open this, the outside of this is okay to be clean. Once you open this inner flap, that's when you're gonna get to the sterile part. So you're gonna grab this fold that's right here, open it, again, try to pull it a little taut so that it doesn't fold back up on itself. You're gonna change your gloves and do hand hygiene. Remember, we're not reaching across our sterile field, so I'm gonna come around and go like this to do my hand hygiene. In sterile gloves, they will always come with the thumbs facing out, right? I'm pretty sure that's true.
Yeah,
I never
you
remember.
put it on. They should, some of these don't. But yeah,
So we made these,
cheaper
so
brands.
sometimes they don't, but real ones should always have the thumbs facing out like this. And they usually are, there's usually pictures on the package, like this is the right glove, this is the left glove.
Yeah.
So what you're gonna do with your first glove is you're gonna take your non-dominant hand and grab just the edge of the inside of the cup and just open it a little bit. And then you're gonna pick it up and start sliding your hand in. Because I'm not sterile right now, but I'm only touching the part of the glove that's gonna go against my skin. And I'm finding the thumb hole, and then I'm gonna try to slide it on without opening the glove yet, the cuff. So you can tell that that's not the easiest thing to do. Just take your time, that's why it's helpful to have the right size. Now that I have this glove on, this hand is sterile. So I need to make sure not to touch anything that's not in my sterile field. I've noticed here that I didn't, excuse me, pull this all the way down. So I'm just gonna do that now with my non-sterile hand just to make it so that my sterile field's open. Okay, so now with my sterile hand, I'm gonna grab inside the cuff because now everything that, as I pull it down, this is gonna be touching the outside of the glove, which is the sterile part. And I don't want to touch my hand, my non-sterile hand with my sterile hand. So I'm just gonna get my hand in there and gently, again, find the thumb hole. This is always the hardest part for me personally. Other people may not have that struggle.
These are like lunch lady gloves. They're
Yeah.
terrible.
These don't have the best. And then I can start bringing the cuff down. Now both my hands are sterile and I can kind of start extending the cuffs out. Okay, so now I'm free to start touching my sterile field. This you will want to prepare ahead of time before you approach your patient. You want to fully get your catheter set up, and you're free to start touching anything inside this box. So there's a tray here. I like to lift the tray out. Everything above the tray is a drape. There's a drape with a hole in it. You may or may not use this. For a male patient, it's kind of nice to use. For a female patient, it can kind of get in the way. Mikkel usually teaches just throw this straight away. But sometimes I use it because it helps just kind of cover your patient a little more too sometimes. Notice how I have my hands like this. My elbows are tucked and my hands are up. Once you're sterile, right, your hands go up and they stay there, right? Because we don't want to be, your hands, nothing below your waist is sterile. So you don't want your hands to be below your waist. You don't want to be accidentally touching things that aren't sterile. So it's good to just have your hands here in a position that reminds your brain, I need to be careful with my hands. And then when you're not actively using your hands, you can have them like this, so that you're making sure you're not just like touching things, especially if you're like me and like to like talk with your hands and lean against things. Okay, so I have my tray here. What's gonna come in your tray is 3 wipes that are pre-saturated with iodine. There are other trays that we have where you have to open the iodine package and soak the cotton. You need to use all of the iodine in the case where you have to soak the cotton. So in here, notice I have a trash can right below me. I'm just gonna drop it and it didn't hit the trash can, that's fine. I'm gonna leave it there for now, because if I go touch that, I'm gonna contaminate myself. I'm gonna kind of prep this so these sticks are easy to pull out, and put it in a place here so it's easy for me to just pull this out. The other thing that this comes with is my lubricant. So I'm gonna take the cap off my lube, pour it in my tray, and that way I can dip my catheter in there. Trash. And I have my sterile water. I'm going to attach this trash. So when you do a lot of sterile fields work, you're throwing things on the floor a lot. Foley catheters always come with a clear sheath over it. Since I'm sterile, I can touch this. So, and I'm just dropping that in the trash. Make sure that this stays within your sterile field. Notice how floppy it is, so it's really easy to be like, we're not gonna do that. We're just gonna make sure it stays in your sterile, but I like to put it in my gel here. I'm not gonna saturate that because we're not supposed to put that on the mannequins. So then I'm gonna attach my water to the port that you use to inflate the balloon. So this port will actually, a lot of them say balloon on them. So
They also tell you the size of the catheter as well. If you have to take one out,
Yeah.
or put a new one in, or you forget, you can go back and look.
So the other things that are in here are a specimen cup if you need to take a urine sample, and your Foley bag, your collection bag. So now that I have this ready to go, and I have my thing sitting in the lube, and I have this attached, I'm gonna take it to my patient. The way I'm gonna do that is I'm gonna bring my sterile field to my patient. I've gently folded my sterile drape underneath here. I'm gonna pick it up all as one, like this, not touching my arms, and I'm gonna place it in between my patient's legs. Here. When you're a nurse, you get real good at just using your feet randomly. Okay, so now I'm going to go up to my patient. Okay, Trent, I'm gonna start touching you. So you're gonna feel my hand touching your penis. I'm gonna grab the penis, and I'm gonna keep it in a 90-degree angle, and I'm grabbing just below the head. If this male was circumcised, I would retract the foreskin. And then now I'm gonna start getting my sterile field. So I have my 1 swab of betadine. For a male, you're gonna do 3 circles around the urethra. So 1, trash, 2, trash, or floor, 3, trash. We're gonna let this dry. Always 3 swipes. Now I'm gonna say, okay, I'm gonna start inserting the catheter. You're gonna feel some pressure. I'm gonna take the catheter. Will you spray the mineral oil on it for me? So in your videos, when you're using this, you're gonna have a buddy come and just spray your catheter for you. Don't have them grab it though, just have them spray it on. And you probably don't wanna hold it over your sterile field because that's not sterile. Just kind of have it off to the side. Or even have them spray the lube on your tray as if it was the lube and then dip your stuff in it. Now you're gonna start feeling some pressure. You're gonna take this. Notice how this all comes with me. This is why we bring it to the patient, because otherwise it would be dragging over non-sterile stuff. Okay, all right, here we go. And I'm just gonna start slowly inserting. This mannequin has a lot of resistance.
So it should be straight up and down when you put it in.
Yeah.
But we can't do that with this mannequin.
Do those mannequins produce fake urine?
No, urine. Maybe this is too big for this mannequin.
Thank you.
Give you another.
Give me another penis. You get another catheter in real life.
There's no painting when you put it in her, because I've seen it once. And
So sometimes you can give your patient a pain medication ahead of time. You can also use, instead of the lube that comes in the package, you can use lidocaine
That's what you
lubricant.
use, yeah.
And so if you're using that for a man, you would put it in the urethra. You would actually inject it into the urethra. Okay, so Jim just gave me another catheter. I'm just gonna hook this to here real quick.
Wait,
Oh,
so-
that's not gonna be quick.
May I interrupt?
Yeah.
I'm a little bit confused, so we don't use the lubricant, we're using the mineral oil?
Only because of the mannequins.
Okay,
Yes.
so we're gonna go
That's
through
the
and
little
say,
caveat.
I would use my lube, however,
Yes.
we're going to be having somebody come in and use mineral oil.
Spray the mineral oil.
Yes,
yeah.
yes, that's exactly what you're doing.
And I would say you're gonna kind of keep sterility, but if they break sterility or something, you're applying the mineral oil in real life. You don't have somebody sit there and spray something. They might hand you something like I did in the sterile field. You know how you open it like this outside of the sterile field. You don't introduce it into the sterile field though.
You spray the mineral oil again?
Yes. And this stuff is weird and
It's not aerosolized, so it just comes out like a
Oh.
gloop. Or a lube. There we go, alright.
Is that okay to do for the video?
Let's ask Tina. Okay, so 90-degree angle, inserting. Alright, this is going in. And I'm just inserting over and over. So now my dominant hand is my sterile hand, and my non-dominant hand that I'm holding the penis with is my dirty hand. So now I cannot touch my sterile field with my non-dominant hand. You're gonna insert until you see urine flashback, and you'll be able to see it in this clear tube that's connected to the Foley catheter. And then once you see flashback, you're gonna insert for another 2 inches, and then you're gonna start inflating the balloon. So you come down here. This is why you want it connected ahead of time, because now you have only one hand to do things with, right? So you're gonna start slowly inflating the balloon. If you feel resistance while you're inflating the balloon, you may still be in the urethra, so you'll want to stop and advance some more. Same if your patient is experiencing pain while you're doing that. This mannequin does not allow me to put the full 10 cc's in because it doesn't have like a pouch with urine. So I'm just going to pretend I've inflated my balloon. You take it out. There's a valve here that should prevent the water from coming out. And then leave it there. And then you're gonna have a securement device. So you can take that off, you can just rip it off, and you're gonna take the securement device. A lot of packages come with the securement device. This one doesn't look like it does. There's some in the back for sure.
is there?
Yeah.
I'm not doing anything.
No, not back there on the cart.
No.
But you're-
That's latex and that's silicone. I think that's the problem with the catheters.
Oh.
So that's another thing to think about too, right? Like latex allergies.
So you're gonna secure your catheter in a way that is not taut, right? And think about your patient moving too. So the purpose of the balloon is to prevent the catheter from coming out. The purpose of the securement device is to prevent the urethral trauma from catheter pull. This would obviously hurt anyone's urethra. Okay, so you're gonna take a securement device. You're gonna make sure the leg is clean. You're gonna apply skin barrier protectant, and then you're gonna apply the securement device to the leg. I'm done with my sterile field, so it doesn't really matter now that I'm contaminating it. But for your purposes of your video, you might want to just trash. And then I'm gonna secure my catheter here in a way that it's not taut. If my patient started moving, it's still not gonna pull at their urethra. Then you're gonna make sure that your drainage bag is below the abdomen on a part of the bed that does not move. These beds have a specific hook for a Foley catheter. So do not put these on the side rails. Put it on like the bed frame. So you're gonna hang it down here. Maybe that's the side of my bed. And the other thing too is you wanna make sure when you secure your catheter that this part of the catheter is facing up. Because if it's down like this, it can cause a pressure ulcer really easily. So you secure it so this part's facing up. bag below the abdomen or where the bladder is. Then you're gonna do pericare again because you just got lube and betadine everywhere. And make sure your patient is in a safe position, that they're warm and comfortable, they're covered, and hand hygiene. Document. This is what a lot of people got wrong in their videos. This is a starred thing on the ATI checklist, that you need to actually go into this patient's that's in the assignments EHR tutor and document in the LDAs that you added the Foley catheter. Any questions? Did I miss anything?